More than anything, I learned what the family house was really all about for them. And for the family that I spoke to particularly, they were driving a long distance, and the husband was receiving chemo treatments. And he was able to go into the hospital during the day, and both were able to come here and be together when he wasn't getting his chemo treatments at night. And I believe they did that during the week and were able to return home on the weekends and then come back the following week. He had several weeks of chemo scheduled, so the fact that the family house took care of that part of his treatment for him and made that part a little easier. And they had family away from home, but no family close here. So it was really like a family. They talked about getting to know the other families and what they were going through and cooking meals together. So it was the overall experience that really opened my eyes as to what the family house does for families. You know, I don't think, Dottie, that I had really thought a lot about all the entire impact. In nursing school, we focus on assessing the patient. The focus is on the patient, but the ecological model that you talked about and how all the different aspects of a family's life comes into play when there's an illness. And I think the thing that sticks out to me, or the thing that I learned the most from that, was we as care providers tend to focus so much on the patient, and we don't think about the fact that when we're out of the picture, that other family member is really the primary caregiver at that point in time and actually through the process. And we need to make sure we include them in our conversations and in understanding what's going on with the patient and the patient care. The night that I was here, we had the opportunity to, as nursing students, to talk with PAs and to also talk with folks that were in medical school to kind of get an idea of the different models that they look at and the way that they come at healthcare. And so it was a really good opportunity. We also participated together when we interviewed the families. So it was good to kind of see what our different focuses were and what angle we came at with trying to uncover information and get to know the family more. It helped me once again to focus on the fact that caregivers tend to focus on the patient too, and they can let the care for themselves go to the wayside. And so it really gave me an opportunity to be prepared when I came in to talk with this primary caregiver, to ask her about herself and how she was doing, and if she was also taking care of herself during this year-long process that she had been taking care of her husband. And that part would always continue, but you knew that she had put things aside and had really focused on him. So it was good to have that conversation to say, hey, you've got to be healthy too to do the best for him too.